Pitt County, this hospital, realized it could not continue to grow, and it was expanding. It's in East rural North Carolina, and it's become a large hospital system there. It couldn't continue to grow unless they retained their nurses. What they do now is they developed a program. They're older nurses. They developed a program where they take, in this case, 25 nurses nominated each year by their supervisors or by their peers who've been with the organization at least 10 years, and they take them to a 3-day off-site meeting where they're paid just normally. This is paid education days. And the first day is basically spent, they go to a seaside, a beachside retreat. Not too fancy, but they basically spend the first day de-stressing. They get their, all their technology off, they get massages, they get walks on the beach, they get away from their kids, they get to relax. The second day is spent with the organization, reminding them of how valuable they are to the organization and letting them know how much the organization values their contribution and their contributions to the teams they work on. And also, they bring people in who are their peers who have done particularly creative things with their careers, gone on to new leadership positions within the organization, gone on for extra education, for extra certification, different degrees, but all within the healthcare system, within that system. Then they spend the third day doing what they call job sculpting, which is helping these nurses develop a strategy for what they want to do in the next few years with their careers. Again, ideally within that system, that organization. But they get them thinking and they re-energize them. These nurses return from that event, that 3-day event, so energized and so committed to the organization and appreciative of what the organization has given for them and done for them, and very excited about the opportunities for them, again, within the system. This organization put about 150 nurses through that program in 7 years, and only 4 have left the organization. They have an incredible retention rate. One nurse turnover costs at least $70,000 to replace, not even counting the lost experience base. So it costs them $1,800 per nurse to run them through this program, so saving 1 nurse a year more than pays for the program. That's a pretty unusual example, but it's the kind of way organizations can invest in older employees, experienced employees, to help rejuvenate them and re-energize them and see what their options are.